I'm gonna be showing you how to be a pro nurse. I wasn't able to post this earlier because, I'm gonna be making up for other videos that I'm probably not gonna post the next few days. So, yeah. I recommend starting in here as a pro nurse. Sorry for the background noise. My brother is calling someone right now. They might say like something different, like depending on their personality. So, like my patient said, it's nice to meet you. If it says take them to an ER room, then you have to go to the emergency room and right here. This is for beginner nurses, and this is how to also get a lot of XP. And then I also want to inspire people if they make a hospital. Also, this right here is a patient gown. Sorry guys, I had to So like my patient has flu. So now you have to check their heart rate. Now I'm gonna tell you where the vitals cart is. The vitals cart looks like this, and I don't know what that noise is, but don't mind it. Crap, I think it's my charger. Okay. So your patient's blood pressure could also be bad, but my patient's blood pressure is good. Sorry, someone commented on my video. I'll reply back though after I'm done with this. Okay, cold compress. I really got inspired by a YouTuber to, inspired by someone to do this. But yeah, now the ice pop or food, or whatever, the snacks. I'm gonna get the ice pop right here. Alright. Oh my gosh, he's having a seizure, guys! He is having a seizure. Oh my gosh. No. Don't die, please. Don't die, please. Okay. I know he's just having a seizure, but I don't know why you just have to keep an eye on him. I don't know how to help him. Sorry, I have to keep checking if my microphone's on, because I always forget to turn on my mic, and it's so ridiculous. Now, no, you have to wait for the doctor to review the symptoms normally. Oh, just the doctor taking a while. You just have to watch your patient if they ever have a seizure. I'm just saying that because your patient can sometimes have seizures. Oh my gosh. Oh, are you having a heart attack? I can't do anything to help you. I can't blame you. Okay, anyway. We're not gonna talk about that. We're also not gonna talk about me. Keep checking my mic. Okay, so the supply room is right here, or storage room. I don't know why it says storage room instead of supply room, but that's a really stupid way to put it. Anyway, the gloves are right here, and the, ER, and then your patient will say different things. They might say random things sometimes while you're, doing the sample, and also the samples are in there too. Now the tube system, if you ever need to put a sample or get medication for your patient, I recommend starting off with the lobby patients instead of the ER patients, because honestly the ER patients are a bit harder. If you feel like you can do them, then you can do them. but they're harder, just so you know. Okay, so my patient wants a soda. If your patient like wants a food or drink, then you go here. So I have to give this soda to my patient. Now, you usually have to wait for the lab. Like I said, I recommend doing the easier. If you're just a beginner, then I highly recommend like doing the easier analysis first before you get to the hard ones. Now, usually, sometimes you might have to have a doctor come diagnose your patient, but on Saturday, next Saturday, they're gonna have a new update whenever doctors have a lot more things to do instead of diagnosing patients and stuff like that. Dr. Liv is here, or Dr. Molly. It says Dr. Molly on my screen. Oh, her name is Livy. Okay, the doctors usually have to check a lot of things. You just leave them alone for a minute until like they order like the test and stuff like that. Sorry, I had to keep like zooming out on the screen. It looks like he's positive for blue A. Okay, so now if you need to like check their vitals, then you just like press on the patient. Like my patient's temperature is good now. Now, the vital signs will usually pop up and put in the vital signs once it says to report them. Now, you just let your patient rest. Okay, so they will usually trigger their call light if they want to leave. Discharge basically means leave. So you have to, before they leave, you have to press you just press discharge papers on the thing. You just press on the printer and press discharge papers. Now, you have to make sure to press on the right paper because, gosh, it's so annoying when you don't press on the right paper. I'm joking. I'm not joking, but I'm not joking, but at the same time. Yes, I will also be posting like another video after this to make up for next week because I won't post next week. I usually post every week. I post a full video every week. Looks like Robert's leaving. Now we're gonna go ahead and claim another patient. Apparently that girl already claimed that patient. And now you can... Now, if you feel like you're ready, then you can do the ER patients, but yeah. Okay, sorry about like all the people commenting on my videos. Like I said, they'll do certain things. Sorry about like all the notifications popping up. That's people commenting on my other videos. Okay. Now, if you're ready for the more advanced ones, then you can go to the ER room if you just want to go straight to the advanced ones. Oh, warning, they are a bit harder. Alright. Like I said, you just have to check their blood pressure. That's high. Oh my gosh, that's high. She has high blood pressure. Okay. It looks like, she's at a 7. IVs, it'll say saline or antibiotics. So it's usually not blood IVs for some reason. Like, none of the illnesses have that, but yeah. Now incline, you press incline, you press the up button, not the down button. My patient has appendicitis. If yours does too, then you can like press the incline or whatever. Now, using the ice machine, it's a machine that says ice. It's pretty obvious. Sorry, I have to keep checking if my microphone's on. It's so stupid when you forget to turn it on. Sorry, my brother is being goofy. Like, sorry about my laughing. My brother's being very goofy. Okay. Now, if it says you ever like need to bring them to like a scan room or like radiology, like CT, MRI, X-ray, or ultrasound, then you would usually bring them here. But if you need to bring your patient to the CT scan, then you here. There will usually be a button where you insert the bed and remove the bed, and you just start on this tablet. You just press start scan. And you have to wait until the scan. Yeah, it's done. It doesn't take long. So you just like watch the patient. I usually say CAT scan in use. Now to sign in, you just press sign in, and then the green button, just press send results to MD. You press that, and then it'll send the results. Now you remove the bed, and then you can take the patient back to bed. It doesn't really matter which bed. I'm just gonna take my patient over here. Ew, she's vomiting on me. Okay, anyway. Like I said, the IVs are right here once again. I usually have different types of IVs. Okay, so, you have to wait for the doctor. To review the symptoms. Now let's do the blood sample. Bro. Yeah, my brother's screaming really loudly, so don't mind. Don't mind the screaming or laughing. He's calling his friends. And like I said, they might say different random things once you give the samples. Okay, so now you just move the capsule over here and then add the item to the counter capsule. And yeah. Now you will dispose the gloves. There's a trash can right here and there's a sink right here. There might be sinks in these rooms, for example, like the regular rooms, but not the ER rooms. Dang it. The lab usually takes a long time. Warning. Okay. So wait here for a couple minutes. Now, the doctor would come in and diagnose them. They would ask how the pain is, and then they would also like have to tell the patient their symptoms, or what symptoms the patient has. They usually have to also listen to their breathing and check their reflexes. And then now the doctor usually come to the computer. Sorry. And then they will diagnose the patient and say that they're going to order tests. If your patient ever needs surgery, like after you treat them, like they need something removed, then you print a consent. It says consent form. Do not pass discharge forms if your patient needs surgery. I got no idea what that sound is. It might be the wind. Now, the vial box is the brown box. Now, if your patient needs to be transferred to pre-op, then you have to wait for the thing. Sorry, my mom's opening the garage. Then I would normally just grab the bed and put her in it. Now you go up the elevator. Now you go past the surgery, which is where they're gonna get their surgery. Sorry, someone's having a code booth for some reason. I don't know why. Now, the last thing that I would usually, not the last thing, but let's do the last patient. And then I gotta start working on my next video. So, I'm gonna do, Robert. Alright, I'm sorry, I have to check in the patient. Someone just have a gun. Anyway, we're not gonna talk about that. So help, the elderly patients are usually so sweet, but they do walk slow. So I usually grab a wheelchair for them. If your patient's an elderly, then I would highly recommend getting a wheelchair. So that way you can go faster. It doesn't really matter which room. Now, the patient gowns are over here. Now, again, you would have to check their vitals. Sometimes they can be good and sometimes they can be bad. And see, the blood pressure's bad because he's dehydrated. I can already diagnose like every single hospital. Because I played this game for a long time and I'm teaching beginners how to play it. The EKG machine is right here as like a little heart symbol. If you have like an EMT patient, for example. Now, the IV saline, you just do the oxygen mask right here. If your patient needs water, the water's over here. Okay. Now the doctor's gonna review the symptoms. The doctor does take a while to review the symptoms. So sometimes your patient might need like a sample, like I said. If your patient needs a blood sample, then the blood samples are right here, the urine samples are right here, and the swab samples are right here. Okay. Oh, his doctor takes blood every other week. Now, you could use the guide to the tube system. I think it would be easier for my beginners. Again. Okay, so now, the sink is right here again. And you would usually have to wait for the lab right after you do a sample. Okay, I'm just gonna check if I'm recording and stuff like that because, you know. Alright, so if they trigger their call light, then you go to their room. And again, if you're working in the non-emergency rooms, then you get a sandwich right here. I don't know how he can eat with the oxygen mask on. Now, you would have to let your patient rest. If you have a dehydration patient like me, sometimes they can code, and then it will say their sodium is high. Sodium is like salt or whatever. Now, I'll usually say like disconnect everything, like whatever you have on, and then this is if they do not need surgery or if they do not code, then they can go home. If they code, then you would have to take them to the ICU after. The ICU is upstairs, by the way. Now, I'm gonna file this. Okay. Let's send my patient home. I really hope you enjoyed this video, guys. Make sure to like and subscribe. I'm not forcing, but you can like and subscribe if you want. And then follow my Roblox account. Bye!